A healthier you, making diabetes history on Guam.
Presented in partnership with Calno Select Care and Paradise Fitness Center.
American Medical Center's Dr. Erika Alford is one of Guam's leading endocrinologists. Born and raised here, she's dedicated to advancing the health and education of island residents. Over the years, she says technology has shifted medicine by leaps and bounds. Dr. Alford recalls a time insulin was delivered through glass vials that had to be boiled before it was administered, and a time when there were no glucose testing kits. The only thing that was used was a dipstick to measure sugar in urine. Technology, she says, has also grown beyond the pricking of one's finger.
There's a little sensor that gets placed right on top of your skin. Depending on the brand, it can be on your abdomen or on your arm. And there's a little tiny filament that is the thickness of about 2 hairs that stays underneath your skin. Now, patients always panic thinking that I'm going to leave a needle underneath their skin, but that does not happen. There is a nice little device that has the sensor already attached to it that contains the needle, where the needle goes in really quickly, leaves the filament behind, and the needle pulls out. So the needle stays here and you toss this device. And so underneath your skin, there's a little tiny filament that continuously checks your blood sugar. And depending on the device, there may or may not be a transmitter that tells your reader or your receiving device what your blood sugar is. Now, your receiving device could be your smartphone as well. And the nice thing with the devices that transmit the blood sugars is if your blood sugar is rapidly going down or rapidly going up or too high or too low, it sends you a warning saying, hey, gotta go check your sugar, so that you whip out your phone or your receiver to see what your blood sugar is at the moment.
It also has the ability to alert you through your smartphone when an individual experiences abnormal blood sugar levels. And if you have a child that has been diagnosed with diabetes as a parent, you can also receive a notification. As for Dr. Juan Espinoza, the guiding principle over his work over the past decade has been that data and technology has the potential to narrow the health gap faced by underserved communities all over the world.
What's really incredible is that diabetes is this uniquely quantifiable disease, both the disease process, so the changes in blood sugar, as well as the treatment. We can really measure in very, very finite, granular ways. And so it's this fascinating opportunity to really bring to bear advanced techniques in data gathering and data analytics to really change the life of one person with it. But if you go beyond one person, then we start thinking about what is the health of communities? What is the health of the population?
Dr. Espinoza is AI Health's Chief Medical Officer and Chairman of AI Health Clinical and Technical Oversight Board. AI Health will be conducting a validation study on Guam. The company specializes in using artificial intelligence and Internet of Things to provide simple healthcare solutions that work in real world today. Tomorrow we'll continue our series on the future of diabetes technology.
A healthier you, making diabetes history on Guam.
Presented in partnership with Calno Select Care and Paradise Fitness Center.